Good evening, good morning, good afternoon, and greetings of the day. Okay. Thank you very much for joining in today as part of our Cancer Survivors Day for a panel discussion. WeCare has been in the cancer care fraternity for the last 28 years, and it is a very patient-focused and volunteer-driven organization. So for being in existence for so many years, WeCare has had many partners with whom it has grown and also learned in the process, be it national or international. Our topic for today's panel discussion is building partnerships and collaborations in cancer care, a community engagement. When we work together, we achieve and grow. We grow, we have greater impacts, and also build awareness and advocacy. Enter new geographies, provide new services, or reach new beneficiaries. Sharing of new ideas, skills, and sense of purpose. And also working together to find innovative solutions. The moderator for today's panel is Mrs. Vandana Gupta, founder and chairperson of WeCare Foundation, and also a very strong patient advocate. She has been a mentor, guide to many in the cancer care field or for others too. The floor is yours, Vandana ji.
Thank you, Jyoti. And good evening to each one of you. Good evening, I can't say good night, but good morning and good afternoon. And it's really a great pleasure to have you from all over the world. It completes our thing of going international and learning from international partners. I have long relationship with the International Kidney Council because we've been there for a long time from the time it was set up. Then with the Lymphoma Coalition, where I met one of the members at a meeting, and that's how we got involved with the with the Lymphoma Coalition, and of course with Sarcoma Spain, where we have great friends. So internationally we are well connected. We are very happy to be with the support of the pharmas and all the companies, and of all our all the people who are working in the various support groups. So it's a great pleasure, and I think our collaboration has started in some way, but what we really need to do is focus a lot and go in a more focused manner. So thank you again. And before I start, I would like to have each one of you introduce yourself. I'll start with Prue, and then Prue can hand over to the next person.
Hi there, everybody, and it's such a pleasure to be here, and thank you very much for the invitation to be part of this. And my name's Prue Echeverry, and I'm with Lymphoma Coalition and supporting the region of Asia Pacific. And the Lymphoma Coalition has a very strong focus around information and advocacy and community building and capacity building and working together, and began indeed from a collaboration that started with several patient organisations who hadn't previously been working together to do so. So I really look forward to this discussion and being part of it. And next on my screen is Vijay. So I'd like to introduce Vijay to introduce herself.
Thank you, Prue. Thank you, Vandana, and everybody at WeCare. It's always such a pleasure. It's such an honor to be part of the celebrations that WeCare organizes every year in this time of the year. 28 years, that's something really amazing. I'm Vijay Venkatesh. I look after the work of the Max Foundation in India and South Asia. At the Max Foundation, what we really feel and what we believe is that where you live shouldn't decide whether you can live or not. Geography should not be anybody's destiny. So we work very hard with our pharma partners who on humanitarian grounds allow us to work with them and patients in need. And that's basically what we do. And thank you once again.
So Vijay, you have to
yes, I have to pass the baton on, right? Okay,
yeah.
So I am going to give it to Brian Lewis.
Thank you, Vijay. Appreciate that introduction, and thank you for this honor to be here today. My name is Brian Lewis. Vandana, I've known for a number of years through the International Kidney Cancer Coalition, which is a consortium of, I think, over 43 affiliate members from around the globe of kidney cancer patient organizations. We gather together to talk about best practices and other things. So I met Vandana through there and VCare and all the work that Jody and others are doing. So thank you for this opportunity to be a part of this panel. Collaboration is a big thing that I, as the president of Kidney Can, really believe in. We started in Washington, D.C. and have grown around the country, across the United States, but also have some global opportunities to participate in collaboration. So thank you for this opportunity. I look forward to the discussion today. Oh, and I will pass it off next. So I'll take a shot here. How about to Rajesh? You're up.
Yeah, thank you, Brian. Thank you so much. And thanks, Vandana ji, Jyoti, everybody for bringing us all on this same platform and discuss about collaboration. Myself, Rajesh Asgaonkar. I work for a company known as AGS Federal Life Insurance. So we are into life insurance segment. And I work as the compliance head, company secretary and legal head for this company for last about 12 years. And generally, I have an experience of about 30 years in the similar field. I'm associated with Vandanaji for last about, I think, 7-8 years. And when the Companies Act in India required all companies to contribute a part of their profits towards CSR. And that's how I got in touch with Vandanaji. And now we have a happy long collaboration with Vandanaji, and I want to continue it forever if possible. Thank you. And now I pass on the baton to Satyen.
Thank you very much, Rajesh. Good day to everyone. I am Satyan Amin and I head the Access Group at Pfizer India, and I'm based in Mumbai. My team and I are basically responsible for understanding what lies in the patient journey from the time of incidence of the disease till they get treatment. And everything in this journey that drops them off this journey is basically an access hurdle. If we can understand such access hurdles and correct or take them away, then we can ensure patients move forward in their journey and onto accessing their therapies. That said, I pass the mic on to Alka.
Hi, everybody. I'm Alka Bisen. I'd like to, at the onset, thank WeCare for giving us this opportunity to participate in this fantastic session. I'm associated with Vandana ji for last several years, and I'm really excited to be participating in the session today. I am the CEO for Cancer Patients Aid Association, which is a 52-year-old organization with a mission of total management of cancer from early detection to rehabilitation. We work closely with the healthcare professionals, advocates, cancer patients, carers, donors, celebrities, and collaboratively run programs in every area that impacts cancer. Looking forward to taking some key highlights back from today's discussion. And I'd like to, that's from me. And I'd like to now request Catherine to introduce herself.
Thank you very much, Alka. Thank you for the invitation. I'm really honored to be here. Thank you, Vandana and her wonderful team. We had the pleasure of actually being at Cancer Survivors Day 3 years ago before the world changed, and I'm hoping we will be able to meet again. My name is Katrin Schuster. I'm here for Sarcoma Patients Euronet. Sarcoma Patients Euronet is a network of national patient advocacy groups dealing with sarcomas and GIST, which is a very rare kind of tumor. We've been founded not as long ago as Alka's organization, so we're a little younger. We were founded 2009 as a European organization, and we decided to open the organization up to become international a couple of years back. And now we represent sarcoma, GIST, and desmoid patient organizations, 55 organizations all around the globe from basically every continent apart from Antarctica. We're still working on that. So it's a pleasure to be here. Thank you for inviting me.
Thank you for those great introductions. And we know that we are in amongst the best of the lot, to be able to share our thoughts. So I'd like to start with Vijay, because Vijay, you have had some experience with the pharma companies. You had some experience with having worked with Cancer Patient Aid Association, and now being on your own. So you've actually gone through 3 different things. So what is it that you feel is the most important as far as collaboration and partnership is concerned?
See, when you say the word partnership, what immediately comes to mind is faith and trust. It's any partnership is built on the foundation of faith and trust. So whether you are establishing partnerships with another nonprofit like yourself, amongst your peers, whether you're establishing a partnership with the corporate world, the industry as we call it, or whether you're entering into a partnership with a media house or a communication entity, healthcare professionals, treating institutions, there has to be this underlying what I like to term it as a generosity of spirit, this sense of give and take, and a sense of inclusiveness, because that sometimes is what is missing. And over the years, now it's going to be 3.5 decades now. And yes, I began my work in cancer with the Cancer Patients Aid Association. Alka was my first colleague. I came into cancer care without knowing anything about cancer. I had to go to the British Council Library and learn about cancer. And I think that itself was a partnership, a partnership with knowledge, a partnership with inanimate substances that you turn to something that becomes your lifelong partner, something you learn from, and something you are able to give back to. So I guess it's all a question of give and take. And I come back to these two words, faith and trust.
So I'd like to move on to Alka, because Alka has been working in Australia for a couple of years, and just a couple of years back, she's come back to India. And do you find any difference between the partnerships that you've seen there and what you are seeing here?
So partnerships, I would say partnerships are essentially similar, but the way they are formulated and the way they are projected in different countries and in different situations may be different. So my key learning when I compare the two places was the importance of having real processes and structure around partnerships, the importance of defining expectations, the importance of laying out the rules and everyone in the partnership having a buy-in for that. And I feel that in my workings overseas, that is in Australia and India, I've come across discrepancies in formation of partnership in both the places. So it depends upon the group and the leadership and the buy-in that people have into that group, irrespective of which country you are. So some partnerships in India have worked excellently, and same I would say about Australia. And yet, irrespective of which country I was in, I've had partnerships which, despite several efforts, have failed. And I think for me, the key learning was the importance of having structures, the importance of having regular communication between the groups, and really moving together towards a common objective, which was first written down and finalized by the group. That was really, really important. It dropping off on communication, not being able to manage the boundaries and the set expectations, invariably for me have the reason of fallout of partnerships.
Thank you, Alka. And anybody who would like to jump in, just put up your hands, and at any point, if you want to add on to the point, put your hand up on that raise hand icon, and I'll have your view coming in. In the meantime, I'll go to Catherine. Catherine has been working with the Sarcoma Foundation for a long time, and she's also been collaborating with a lot of pharma companies and a lot of other organizations, and so maybe she really understands what are the challenges that she faces and what happens really, and how do you go about having a a really good relationship with everybody.
That's a very good question, and I think Vici and Alka have already touched on a few things that I would definitely support and underscore. It's the topic of faith and trust with each other, and also setting the boundaries or the framework. So expectation management is, from my point of view, is a key thing, because we all enter into partnerships expecting something from it. And I think that should be on the table from the beginning on what can we expect from each other? What do we want to achieve? So this is, for me, it's the key thing. We're actually in the process of entering a partnership with another organization. And at the moment, we're not quite clear what they want and what we want. And my feeling is if we communicate openly and transparently, that can be a success. And that should be, as Alka has already said, communications is a key thing from the beginning on and through all the process of a collaboration. So I think that's the thing that will make it work.
Okay. So Brian, I know you've been doing a lot of research for kidney cancer patients and also do a lot of advocacy. So who do you think can be your partners for research? Like who all would you like to be involved? And how do you want to, like make the efforts to break down all the reservations that come along with it?
That's a great question, Vendetta. Thank you. And again, the comments already, I'm scribbling notes here, so I'm hopeful that we can get a copy of the recording because there's so much richness. I fully agree with VG when she talks about faith and trust. I 100% agree with that. And I believe also that an outgrowth of that, at least from the patient perspective, is the creation of hope. I think when you do collaborate with others, as a patient and you hear from experts and you dig in and you start, understanding and have this thirst for knowledge around what's going on in your life when you now are confronted with cancer, is that these experts have created a lot of information, science, evidence-based information is out there. You have to sift through it. And if you collaborate with others, you can create a sense of hope that a cure is coming. And I think accelerating cures is what our organization is all about, and we can't do it by ourselves. One person is not going to solve the cures for kidney cancer, and so we have to reach out as a community and be a part of a bigger ecosystem. So to look towards partners and research, we find the kidney cancer experts, and there are other people and other organizations around the globe, and the IKCC, the International Kidney Cancer Coalition, brings those experts together and we get to share and hear best practices. So there's just, it's a great question. We look to this ecosystem to find a lot of our answers. So thank you for that.
Thank you. Mr. Amin, you are from the pharma company and you must have, have your challenges because there are patients to be looked after. That the company requires certain, data information and all that, and you still have to collaborate with the NGOs who may not be so familiar with all that. So how do you think that that gap can be filled?
Yeah, so before I come to the NGO piece, let me say and build upon something you asked before, which is what comes to our mind when we think partnerships. From my standpoint, look, we can't have a car manufacturer just partner with somebody who makes tires, right? We need to partner with chassis, engine, interior providers, etc. Similarly, I don't think any of us can just partner with one stakeholder in the system and look at the patient who we keep in the center and say, I have helped that patient. Yes, you may have helped that patient for that bit, but we need to make sure that the patient goes longitudinally and we help them longitudinally. And that is the crux to me about partnerships. It takes all stakeholders and all elements of the system to actually build a partnership. And I think that is forefront to me. Speaking about the specific space from a pharma company standpoint, you're absolutely right. We directly cannot interact with patients, even though we have our products. And therefore, we go through partners who then can interact with patients and help. So NGOs, third-party organizations that run our support programs, doctors, of course, who are more than just partners, they are our key customers. The whole ecosystem becomes important for us. What comes in my mind is that, indirectly, we have to try and work with patients. And these intermediaries or partners are the ones who actually work directly with the patients. They understand them the most. And therefore, we have to go and trust them that what they are telling us, what they are telling the patients, and what they are doing is actually the right thing. We would like insights. Pharma companies actually like insights because what good are our products if the products don't reach the patients? But these insights and what therefore to do and bring to the table, how can we help in all the way from awareness till therapy adherence? That can only be told by our partners. And to me, that's the most important.
Thank you. Prue, you've been helping out VCare in forming a partnership amongst the various NGOs, and you must have got a lot of insight into the process while you have been talking to us. So, and I know that like from the Lymphoma Coalition, you've helped in setting up the Asia Pacific region, and I know that you've been doing a lot of surveys to understand. So again, you needed partnership and collaboration for that, and of course the pharma companies and others. So what are your thoughts on that?
First up, if it's okay, I'd just love to acknowledge what Viji and Alka and Catherine said, especially around the kind of structures and boundaries and vision and those pieces that you need, and yes, how they'll fit with the work that we do in Asia Pacific and with the survey more specifically, but entering partnerships with a really clear, we've talked about communication, but a real clear set of what we're setting out to do, because sometimes I think partnerships join and then someone loses the way of their mission a little bit and can get kind of pulled somewhere that they didn't quite mean to go, because it felt good to be in the partnership or it felt useful. And I think I also want to acknowledge that NGOs, no matter how experienced they are or not, start from a base already of generosity and reciprocity, and they already start in that place and are very good at collaborating, but can sometimes have a little bit of naivety about where that'll all end up. So I think there's some watch outs there. We've learned to be very clear, I think, about where we're trying to go and what we're trying to do. And sometimes it takes ages. Really, it takes ages, and you feel like you're going nowhere for a really long time. But if you stay extremely clear to your purpose and what you're doing, and you're passionate about that because it's right and it's right for you and it's right for patients, people come along with you and they want to be part of that. True. And I think the really big piece there for NGOs is, as said, I think we come from that generous space, but we need to kind of just be careful what boundaries we put around things and what objectives we put around things as we go in. And I probably want to add one word or two words really, to what Viji said about faith. I'd also add good faith, doing things in good faith for the right reasons, and respect. And I think if those pieces are there, particularly respect, I think mostly things land up where they do. But like Alka, some things work out well, and despite really good intentions and structures, some things don't as well. And it's learning when to know and be able to communicate about that.
Thank you, Prue. Rajesh, I think you have the toughest job to do, because you have the CSR funds, and there may be many companies like you who have the CSR funds and need to get involved with NGOs to do the work. So first question is, how do you choose a partner? How do you choose a partner who would be a good partner for your CSR activities? Would it be based on a CSR, something that you already have in mind, that you want to help a certain group of people that you choose your partner, or is it that you assess the value of the work that they are doing and you choose your partner? So that will be the first question.
Okay. Vandanaji, thank you for this question. I think the tone of this discussion was rightly set by Viji, and then added on to that by Alka, saying that everything starts with trust and faith. Particularly from the corporate's point of view, when you have to distribute funds, the first thing that you need to ensure is that the partner whom you're going to work with is really credible. Unless you have a credible partner, you are, one is that you will waste your money, but even you will get into legal tangles later on. when your association to a particular NGO comes into a problem. So when it comes, our company is new. In fact, Companies Act itself in India, which mandated this CSR provision, is also not very old. It just started in 2013. I know a lot of companies were doing the contribution to NGOs and helping those people like Tata Group or wherever without having all the CSR mandated obligations. But that was, limited to a certain group only. But this became a mandate as per regulatory requirements. And then there are certain things which are built into the regulations itself, which require that an NGO should be, it should have an infrastructure of a certain kind. It should be minimum 3 years old, and it should have done some work. It should have got experience to work in that particular area. So there are some basic requirements which are there in the regulation itself. But going beyond those regulations, because those are just minimum requirements, a company like ours will choose the partner based on some good recommendation. Like say, VCare was recommended to us by a very good friend of ours, whom we were working on some other project. And then we do a lot of evaluation. We do some due diligence, as we call it, when we're selecting the partner. And then maybe we are not going with the purpose particularly. It's not as if we decided that we will do only cancer thing, or we will because these are our board of directors and this is our committee driven requirements, which and you may have a broad kind of spectrum in terms of education or medical or anything for sports, maybe development, grassroots sports development, that kind of thing. But then you go to a particular, so when you get a project from say VCare, so then you see that, oh, that's a great project on cancer research. It's not that we haven't thought about it, how we can help cancer patients, and this is a good project from a good organization, and why not associate with it. This is the kind of process that we have been going through so far.
So, to continue, Mr. Rajesh, suppose you've chosen your partner and you've given money to them and that's it. So what are your expectations from them in terms of reporting and other things? The second is, how involved do you get in the process? Are you like constantly checking? Not checking is not the right word. Are you like getting involved to find out how they are doing? Or is there something somewhere your employees can get involved in it, or that you could spread the word about the organization to some other people? So what do you think should be, according to you, the right thing to do?
Yeah. So on reporting requirements, of course, we depend on the NGO, and nowadays NGOs are also geared up about. I have seen with my experience of doing a periodical reporting to the organization in terms of a status report. Your organization, VCare, has been doing a very good quality reporting, I would say, to us, which helps us to, give the status report from our side to our CSR committee as well as board of directors. As far as the involvement is concerned, I'm really not happy with the kind of involvement that we have been having. It's not just about my organization, but wherever my friends are also in the CSR departments of the company, I've not seen that the corporates are going beyond a contribution of money. That's a little unfortunate part of it. What I'm seeing is that people are happy cutting a check, and then they are getting a report that the NGO is doing its work, and it's on paper. But unless you go and experience and see what is being done there, I don't think the CSR circle, the obligation of the company is complete. We have been trying to do and motivate our employees to participate in activities in whatever manner possible. They can do visits over there, or they can, somebody can go for a particular event or program, or they can do their personal contributions also for this organization. But I have not really been successful to the extent that I would like to be. There was another point that Satyen mentioned, which was really good, and which said that there should be the car manufacturer doesn't just associate with the tire company; he has to associate with so many people. The same way, we are also associated with different kind of NGOs for different purposes. So I do work with the Care Council. I work with some sports organization. I work to develop a particular area or a particular slum, maybe, or provide education to some areas. All these things, if you think intelligently, can be integrated with each other, and there can be the cause of cancer can be spread across everywhere, or all through these organizations, or other points. Other organizations can take some help from We Care Cancer, so that that we are still compartment, like we are still working in silos, cutting checks for different NGOs differently. We have not been able to integrate those. So that is one regret that I have. I think that's where a lot of work needs to be done from the corporate side.
So, Mr. Amin, do you think your people in your company, Pfizer, are getting involved in the work of the NGOs that you are associated with? Like Mr. Rajesh said that he's not happy about the non-involvement. What is the stake in your company?
Yeah, actually, thank you for the question. And we do have quite a bit of involvement, right from our MD all the way to our frontline field force. We have days where we partner with the NGOs that we support, and we've adopted maybe a village. We go there. We may have paintings with children in the school. We go help them. We may actually teach. So I think we do a lot. At least if we take out one day in 6 months or 3 months or maybe even a year, a family day, get everybody involved and actually do something with the NGO, because it does two things. First of all, that whole cutting the check and then doing lip service is not really the sentiment that needs to be there. But when you actually get involved and do it, you can feel the power of either the happiness that you're spreading or a return to the society that you have the power to give and the way it makes you feel. And I think that builds conviction. It builds conviction to do more and in many other places.
So I'd like to ask either Catherine Prue or Brian to respond to this, that do you have something like a CSR partnership or a partnership with any company? And is there involvement of the company along with the employees, along with the organization to help you out? Whoever wants to go in first.
I can answer something, but I was actually going to refer to some CSR activities that I've been involved in when I was CEO of Leukemia and Blood Cancer New Zealand, and being involved at the same time with the Lymphoma Coalition. And we had a lot of partnerships that were non-pharma corporate partnerships, and staff engagement was a really, I see Jyoti's put that in the chat, but that was a really, really key part of it. And having a deep engagement where the employees could be part of things, and in a meaningful and ongoing way, and very particularly where it aligned with business objectives. So an example was with PwC, and we did a lot of things with them. But one thing that was really quite important was around an employment, patients' rights when they became unwell, and their rights, what they had to disclose and how they could go back to work, and just a whole big piece like that. We had a law firm involved as well. The other side of that, and I'm sure Satya and Rajesh would talk to that, but there's the pride and that people get from working for a company they think is doing good, and when it, but when it's really meaningful, not the lip service that was mentioned. So there's many ways that can be really embedded in the culture and be really, really positive. Can I just make one more comment? There was a comment into our chat around ESG, which is something that's being asked within boardrooms very much in particular.
We'll take up that ESG thing.
Okay.
Yeah. So we want to first finish with this.
And we have very good experience. We also have not so great experience, but my feeling was also around the discussion we just had, and Rajesh mentioning recommendations. It all comes down to who you're working with. So you can partner with an organization, but if you have someone to respond to who is not really interested, then it doesn't work. My feeling is that this is also it's a people business, and I think that's a key thing, and we've seen that with pharma companies and other organizations. If there is not somebody who's committed and engaged and willing to drive this forward, it's not working. So this is another key factor I think is crucial in partnerships.
Okay, so thank you, Catherine. And Brian, you want to add on something there?
I think Vici is.
Yeah, VG seems to be wanting to say something. Ladies first, please.
Okay.
Thank you. I put up the yellow hand and I said, I'll need to put up my proper hand also, because there's something that Satyan said, which was very impactful. Satyan, you said about having the power to give. And I think that is something that itself is such a powerful phrase. When you have the power to give, you put yourself above a lot of entities, because that is great strength. In the power to give lies strength. And then I think over the years, all of us who work in the nonprofit sector, who think of ourselves as, and we are patient advocates. And I think we have also begun to realize that we also have that power to kind of, translate your action, to translate the donor, or, as our partner. Let me put it this way, to translate that into really effective reality on the ground. And I don't think when we partner with different, or let me put it this way, when we establish partnerships with various other entities, we should never forget that we too have that power within us, because, we are like the medium. And somewhere down the line, the nonprofit sector, volunteers, NGOs, they kind of begin to feel a very, in a way of speaking, very diminished. And I think when we have partners who tell us, you know what, we have the power, but we are also making you a partner in that power. So I think that is something which is very, very important.
Thanks, Vijay. Brian, you want to add on?
Yeah, I mean, there's so much to talk about here. There's so many great comments. I mean, I think what Catherine said about people, this is people, all of our businesses are people business, but I think it's true, especially here. And I think there's something to be said about with collaboration. There's some emotions, sort of like dating, where you have to get to know another person, and there's some natural harmonies that either happen or don't happen. And if they do start happening, then that relationship grows and it, fosters more involvement with others in the organization. I think one of the points I want to make is that at least for our organization, Kidney Can, we're sort of a younger organization that doesn't have big, CSR involvement yet. But I think there's something to be said about financial support from partners versus financial and human capital support, where you get actual people involvement. And what we've had, at least here in the United States, we do a lot of grassroots advocacy where we bring people together and try to persuade our congressmen and women about what we want to see more for federal funding for research. And we found that when we have partners on the industry side that get involved with that advocacy, and they see patients and caregivers putting their time and effort, and they become a part of that effort, it's very powerful. So I think the point there is the more you can build and collaborate with your corporate partners to dive in deep with people and getting involved in the basics of what you're doing, the better off everybody's going to be.
Thank you. So Alka, I'm going to start with you for a new question. You want to say something about this before we move on?
Yeah, I just wanted to add that we've been doing a lot of work with in CSR. And one of the things I felt is that taking on from the point that Vijay made, that at times the NGOs tend to feel a bit diminished. I would like to say that it's a new area, both for the corporates as well as for the NGOs. Currently, the whole corporate social responsibility funding. And just like the corporates are out there looking for the right company, the right NGO to collaborate with, who will, have a proper project delivery, give good reporting, and have the necessary impact. The NGOs also are constantly striving harder to reach that particular status where they become the company to go to for the corporate, so that the partnership is solid and lasts for a prolonged period of time. From my own personal experience at CPA, I do feel that at every stage we have tried to live up to the expectation and tried to find out what is it that the donor requires out of us, and we try to give that in the best and optimum possible way, so that it becomes easy for the donor to come back with the CSR funding or engage with that particular organization the way they had seen it to be or the way they had expected. That's just a comment that I wanted to make.
Thank you. But I'll take it on further with you from there, that, we are happy to partner with somebody. And obviously, since they are partnering with us, they are happy somewhere. But are there some boundaries that we need to set out? How do we say that, because we don't want anybody to interfere with our work, but we do want people to give us good ideas. So where's that boundary? Where's that line that, this is where you can go? Do you feel that there should be a line like that, or not needed?
So is that in all partnerships, or are we just talking about CSR?
No, we are talking about any type of partnership. Suppose you and I want to collaborate. Then
Right.
we are collaborating on a certain thing, but it should not be that, whatever I say has to be agreed to, or whatever you say has to be agreed to. Should that be the thing, or should there be a boundary that you can't go beyond a certain thing? What would be your idea on it?
Yeah, I think I'd again go back to the fact that it's really nice to set the rules and regulations in the beginning and to make it really clear through frank conversations that what is it that we expect, to what extent things will be permissible, and set those expectations so that you can freely discuss and communicate with each other and agree to disagree when required. I think that's a very important thing for any partnership, where we are able to have the freedom to say what we want to say, but be okay about the fact about whether it's accepted or not accepted, depending on what rules we have set. So till you have that really good communication between the different stakeholders, it's really difficult to take a collaboration or a partnership forward. And often in my experience, I have seen that teams which do not communicate as well and do not, stay within the boundaries or agree to disagree or have frank conversations often fall through, because you're not able to overcome things like your own insecurities or issues that you may have with regards to expectations from other stakeholders. And somehow you tend to then lose interest, and the collaboration and partnership just ends or falls through badly, or just hangs in there without any result.
Thank you, Alka. I think Alka has spoken on behalf of all of us who are working with patients here, meaning patient organizations, whether it's PAIN, whether it is Lymphoma Coalition, whether it's IKCC, or whether it's Max Foundation. I think more or less all of us share the same views. But I would like to go to the industry to say what they feel. Because now it comes to the CSR giving or the supporting with access programs. What do you think, that there should be a boundary, or that somebody who's investing should be the person who gives the opinion? Who wants to take it first, Rajesh ji, you or Mr. Amin?
I can take it actually, and I wrote in the chat box that I think first of all an overarching document or alignment on the bigger vision or the purpose or some basic guardrails or a charter. I think these help in why an organization and an NGO, maybe let's say they do some work together. So the funds are given, but then how can they be utilized? And I think beyond that, there should be minimal oversight by the organization. Beyond that, I think there should be more help or assistance given, like we appealed at the fundamental level of actually doing things. Because so it's like saying, okay, you need to do this. Now, once that is set, how you need to do it, the NGOs and the patients, they can decide and they know this best. I think organizations only get iffy because many organizations, to whatever their policies are, they have some internal policies. And I think the worry is only that either the funds are misappropriated or channeled differently, or maybe there's, some faith gap. And I think it all goes back to that trust. But trust can be established by something that is written down, agreed between two organizations, and then you see each other doing what they are supposed to. I think that then can set the guardrails.
Rajesh ji, you have to give your point of view.
Yeah, I completely agree with Satyan, and I also agree with what Alka was saying in terms of having some, basic boundaries. From my perspective, boundaries are essential in any relationship, whether it's husband-wife relationship, brother-brother relationship, or wherever. So it's bound to have necessarily to exist between a CSR contributing organization and the NGO, and this appreciating each other's limitations and appreciating each other's powers. I mean, both are the things on which a good communication, as Alka was saying, would definitely help. In India, honestly, we are not yet graduated to that level of agreeing to disagreeing on a happy note. I mean, we feel that somebody has advised us something or questioned us is an issue. I think that is where we have to grow out from. What I was thinking in this respect, but see, I was just thinking about how the trust gets built, and a very simple example which came to my mind while working with your organization itself, how communication is important to build that trust. Like Vandana ji, we had agreed on a project to say fund female patients of your organization, and you decided that there are not sufficient female patients. You want to do it for male patients. Honestly, from project perspective or organization's legal standpoint perspective, really doesn't mean anything. It doesn't really make difference. But I was amazed, and I was also happy, I would say, that you at least informed me and took our organization's permission, although it was not strictly required, because finally patient is a patient, the gender did not matter. But these small things, when NGO does to an organization, that respect for that NGO goes up, and it's a matter of reporting. It's a matter of saying that, okay, this was not in our charter, but we want to do this. Can we go ahead? This is how the trust gets built over a period of time, brick by brick, and this is a frank communication which helps.
Thank you, Dr. Rajesh ji. So Rajesh ji, you had brought about a new word, ESG. I really don't know much about it, so I have to first look up in the dictionary to see in the Google to see what it meant. So can you please explain what it is, and would you like to talk about it? And I know Prue has a lot of things to talk, so after you, Prue will take on.
Yeah, definitely. I mean, this is an imported word to India currently, so I have a limited knowledge, but this has become slowly a buzzword in the corporate boardrooms. ESG is basically environment, social, and governance score of the organization. So there are rating agencies which actually evaluate the organization and give them a score as to how they are ESG compliant. And we are seeing that when the times are changing, and although organization may be making profit, but if it is not doing well on the ESG thing, the governance standards are low, they are not really giving back to society in the manner that they should give, or they are not environment conscious and destroying the planet. Just by merely being profitable, they won't survive in the long run. There are it's a very broad and very big subject, so I will not really dwell into that, because it will eat up 2 hours or more, and I'll leave to talk about more in this. I had just highlighted in my chat that on the social side, the company that is the point where companies have to do a lot and document a lot, prove a lot to the rating organizations, and really do something which is from the bottom of the heart, rather than ticking some boxes. And that's where this CSR and our today's discussion is relevant.
So Prue, you want to ask something or add on to that?
I would love to add on to it, and I don't pretend to be an ESG expert whatsoever, but just understanding, and it's exciting because we have a global group here, but understanding this as a global trend, which is huge and emerging so fast. And companies are really getting pushed around this. So in corporate boardrooms, they're really getting pushed in ways they might not around CSR. I know you have legislated in around CSR in India. Nowhere else that I know of has that. This is different to that. What is happening in Europe and US and UK in particular, in those countries, is there is a lot of pressure and a lot of legislation now coming around ESG. Mostly it's around the E and the climate piece, and companies are required to behave in certain ways that of being good corporate citizens. But the G is the governance part, and there's a lot that sits under those headings. But the S, which is also the S in CSR, is not being done well, and they're starting to get pressure. Companies are starting to get pressure. So I'm kind of looking, you can't see that I am, but I'm looking at you, Catherine, in particular, because it's a really nice opportunity for you in Europe. This is a very, very big trend, and it's enormous in Europe. So it's a big opportunity for NGOs to be having conversations with companies about the S part, the social piece, because they're not doing it well, and they're not so confident about how to do it well. And of course, it covers internal things in companies that might not be our business externally, like gender equality and diversity and inclusion, but it also covers the society community engagement, and that's our opportunity. And we're certainly seeing here and in Australia and globally and wider, that piece is where companies are getting quite energized. So NGOs who are engaging in that space, it's a very big opportunity. That was really my comments.
Thank you, Prue. So, Catherine and Brian, just for your information, we have a lot of people donating either to the temples, or if there's a natural calamity like an earthquake or a fire or something like that, and people come up and come and make donations and give a lot of money at that time. But so do you have, and then, they're reluctant really to give for a particular cause, like which is a long-term cause, which can be education for children, which can be treatment for patients, it can be anything else. Do you have something like that in your country also?
Yes, maybe I start. So we basically see the same thing. So if we have like an earthquake or natural disaster or something, people start giving straight away, because maybe it's because it's really present in the media and very there. But getting people to donate for like an organization like ours, especially when it only covers not a lot of patients, and that's a crucial thing for us. Sarcoma is very, very rare, and people don't even know the name or don't know what it is. It's very hard to get people to donate. But what I need to say here is that Europe doesn't mean it's one country, because we see major differences between countries. So Germany, where I am based, people are rather reluctant to donate to an organization they don't know and they don't refer to. But we see a lot of activity in the UK, for example, and in the US. I think Brian can take on that. So it differs very much from country to country. But I agree on what you had asked, that people are very open to donate in such a case, but in especially smaller organizations, it's difficult.
So Brian, would you like to add on something?
You're on mute.
I have to do it at least once every day. Sorry about that. I don't have a whole lot to add to what Catherine said. I mean, in the United States, thankfully, there is a propensity to be a giving country. And so we have a lot of contributions that come across the country. I think to the point of, kidney cancer is a small, rare, group. And so we are, have a limited pool of folks that know about what's going on in kidney cancer and would contribute. I think it's nice, at least here in the United States, towards the end of the year, December, we have a lot of more giving, and we even have a Giving Tuesday that's been created, sort of, or has been created. And then I think, you're seeing more sort of people who are impacted, and their families are stepping up. But we've also noticed, at least here at the different grocery stores and pharmaceutical stores, pharmacies, that they're allowing you to round up your change to give to different organizations, and the organizations change quite like monthly or weekly, which is interesting, and another phenomenon that's going on. So, but I think also back to, what Prue was talking about regarding this ESG, that's a phenomenon that's going on here as well across the country, and we're seeing more and more of it.
Thank you. Keeping the time factor in mind, I think I'm going to ask one question, which will be for each one of you. And each one of you must answer this so that we can, sum up the entire conversation. It's that patient advocacy and health literacy have always been spoken very strongly. And we know that there are challenges in India and globally. So, and we know that we have to close the cancer care gap, because there can be towards education, it can be towards treatment, it can be towards so many different factors. So how can we work together to help close this care gap? Let me start in alphabetical order. Alka.
What you've just said is very true. It's really important for us to collaborate and work together to identify the gaps which we can see, and we can start by just identifying those locally or at a smaller level, and get the local companies together and start doing that. We are doing that in a not so formal way, because like it was mentioned earlier, and I think Mr. Amin mentioned, pardon me if I've taken the wrong name, and he said how you have different stakeholders across different areas. So whether it's early detection or whether it's patient advocacy, you have to work with different groups, and we have to collectively work and look out for gaps in each of our setups and see how we can complement each other and work symbiotically towards a common goal. It needs to be done. It is being done informally at various levels, but it would be really good if a coalition or a formal body was developed to attain, say, a particular goal, and then everyone work towards that, or a particular unmet need, and then everyone work towards that. This is, I think that would be a good way to begin, and then it would then cascade down to bigger things.
Thank you. Brian?
Yeah, thank you for that. We're fortunate here in the United States as well. Our president just announced last week the revival of what is called the Cancer Moonshot 2.0, where there's going to be a new sort of renewed interest in cancer care in the United States. And so we're hopeful that just raises the elevation across, all stakeholders in the United States to see this as an important issue. And we have a lot of opportunity to really sort of collaborate as an ecosystem of researchers, and some breaking down silos and just drawing attention to, we are on the cusp of some major breakthroughs. Let's keep pushing forward. So I think we're fortunate here, at least, to have that new effort undertaken by the current administration.
If I haven't forgotten my alphabets, Catherine, you come in next.
I was counting too. So, I think that's a really difficult question to ask, because when it comes to health literacy or patient advocacy, it's always the question where you're working. Are you working internationally? Are you working nationally? So the challenges are they differ very much between countries. And also, when you're talking about health literacies, we find that in general, it's for Germany, I can say it's rather low, but when people are diagnosed with something, they start educating themselves and searching for information. So the thing that if we're working internationally together, and we want to achieve something. One key thing that I've learned is sharing experience and best practices. So what have you done in your country? What can we adapt? And also sharing resources like can be brochures, websites, information, anything, especially in such a field that we're working in rare cancers where there's not a lot of information. So that's a key thing to help people out.
Thank you. So, Prue?
Thank you. I probably just a couple of comments around something that Satyan had said at the beginning about the journey all the way and what are the gaps that actually become an access problem, and health literacy is a huge one. And it's often sort of thought about as literacy itself, and it's way bigger than that. There's so many aspects of culturally about how people are respected and approached and given information and checked that they've understood it. And I think, was it Alka, you said, wouldn't it be great to have some collective sort of system, if I could wave a wand and we could actually work together on health literacy being something that was taught in medical schools, about how to communicate for our industry partners, that needs to change for regulators. It's a huge barrier for patients to participate. And the other piece about advocacy, I was going to say, in the context of partnerships and collaboration, I think we have to be careful to not be tick boxing where patient voice comes in, and to have patients' participation and voice really valued equally, and not be kind of in a lonely setting there, but in a generous ability to participate. And I just want to make a comment about regionally. I think exciting things are happening in Asia and in Asia Pacific where this stuff's being looked at, and there is an opportunity to put the right systems in place that allow patients and patient organizations to participate better, taking learnings from Europe, but not just cookie cutter. It's a different place. We need different things here.
Yeah. Rajesh?
So from donors' perspective, I would, or say a contributor's perspective, I would say that patient advocacy and health literacy is such a huge and vast topic that we will have to look at it from on a project basis. What I mean to say is that we can't just contribute for 1 year to one organization and expect some results to come on this within a year or so. This is like, minimum 3, 5, 7, 10 years project when we will see the results. We have limited resources, and that's where we will have to decide probably that we don't want to spread our resources thin. We can't be investing in 10 projects and getting the satisfaction of getting some publicity out of the same thing which are working. So from our perspective, we have to identify a good partner who will work on these projects on a very long-term basis. And we have to realize that we won't see the results in a year or two or whatever. We have to work on a long-term basis with that.
Mr. Amin?
Yeah, thank you. I think actually they are fundamentally different and yet interconnected. And I'll give an example. I think health literacy goes to making sure the world understands about what we want to make them understand. For example, COVID. The common man, to a lot of extent, even in India, still thinks that this is just something like a cold flu because that's what they hear and they don't want to take precautions, etc. And if you go, the pendulum swings the other way, like in the first wave. Not a soul would go down on the street in the first lockdown because everybody was so scared. They didn't understand. And what they heard was that it's spreading like fire, right? Now, on the other side, therefore I think that health literacy is extremely important. Very hard to do, but important. Patient advocacy, I think, has its fundamental position because I think either, the government listens to opposition or they listen to somebody who's parking and blocking the street for a year and say, okay, now I will listen to the farmers. Similarly, I think they will not listen to organizations. Oh, you big bad pharma, right? I don't want to listen to you, but I will listen to patients because now it's gone to a citizen level and it's made a big hoopla in a newspaper. So I think that's advocacy. And I think they have a fundamental space if we are trying to change the world and make the governments look at a certain direction. They can be linked because unless the patients and patient support groups understand what we are talking about, which is the literacy bit, how will they feel enough to be powerfully advocating about something? And I think overall, we need to have an objective system. So pharma, providers, NGOs, we can't be driving advocacy only to what we need to think and what we need to gain out of it. And I think that's that longitudinal view. Again, I think we need to take objectively and say, here's what the patient community needs really, and here is what advocacy should be about, and backed by literacy.
Vijay, thank you.
I would look at recognizing the fact that fear and stigma are two of our biggest stumbling blocks, whether it is an NGO or whether it is one of our partners. So we need to work together in clearing not just cancer, even COVID. There are myths and misconceptions, and it's a big stumbling block. And I think that is where a partnership between nonprofits and the other, whoever we choose as our partner in this journey towards eliminating these really debilitating kind of thought processes, not just in patients, but in the public, the common public. The other, as advocates, we have the patient's voice, and we are the patient's voice. And we have to use the patient's voice to make our partners feel really privileged. I don't think there is any harm if somebody who is making, who's contributing to the well-being of our organization and therefore to our patients. I think we have to recognize that we owe something back. We need to do reporting. We need to be compliant, and we need to actually carry that patient's voice and make the donor feel proud, make the donor feel that there is a kind of that's a real partnership, and take an ownership, not because they have given us resources, but they have become responsible for us taking the patient to a better place.
Yeah. So on my part, I would like to thank each one of you for giving us so much food for thought. And I think we could still continue because there are so many points which have come in. And Jyoti, I would like you to read the comments because again, because we were all busy in talking to each other and all that, and we could not really pay as much focus on the comments that have come in, but I know they were very nice, and it will be useful for all of us to work on it and think about it. So Jyoti.
Yes. Yeah. So there was, there was a discussion on the chat about employee engagement and what more could be done. So Mr. Amin has mentioned that appeal to employees at a fundamental level, donation matching by employer and letting them follow a CSR activity that resonates with their passion. And also if we can tie this in with the organizational purpose and values, it would be even better. Adding to that, Pru has also agreed to what Mr. Amin has said, and we have seen that this works well. Further, Jogita has mentioned about CSR engagement also proved to be motivating to the corporate employees to feel part of something good, a sense of belonging to the corporate family, as well as be a part of a great initiative, or do the corporate heads face resistance and just part of the job kind of sentiment. So here again, I think Mr. Amin has said that I have to say a lot, it is the part of the job, and I think we need to change that. Else we would have companies donating more than 2% and by employees and citizens and not just the organizations. So again, when an earthquake happens, why do folks volunteer and donate, and why not when there are patients or school kids or sanitation, etc.? I think citizens need to be appealed at a fundamental level or giving back to the society. Pru adds on to it by saying people need to understand what they are giving to and how they can be involved. Not always so easy and uncertain, which is very true. Again, Mr. Amin mentions about vision, purpose, charter, guardrails. Such high-level alignment may ease the process. And also Amishi puts in like transparency and compliance, which also helps in. And about ESG, it is other metric beyond earning per share that we should use to value companies. As Prue mentioned, yes, it is one of the more stronger ones which is coming in the European context, and how it will be helpful for the NGOs there. We really need to look at. Also, it's like, keep feeling okay. So your VG says, "Can very bad at chats during the session." So but don't worry, VG will send all the chat conversations to you. So we'll keep you in the loop. So all is covered, Vandana ji. Yeah.
Okay. So thanks, Jyoti. So as we've come to an end of this great webinar, I think all of us have understood that we can partner with each other. We know that we have our boundaries, in the sense like it has to appeal to both the sides, the giver and the taker. And also that, we need to start working together, thinking of the patient as a focus, rather than thinking of our own organization or our own company or something like that. Because whatever we are doing today is for the patient. So if we can start the collaboration right now or right today with our partnerships, it will be the thing to start with. And I think we've already started. The fact that Brian got up at 5 o'clock in the morning to be with us, the fact that Prue and Alka haven't gone to sleep as yet, fine. I mean, it's all working together. And really great thanks to each one of you. And hopefully, can you please put on your camera so that we can take a nice picture? And thank you very much. Rajeshji, your picture. Jyoti. Neerajji, can you please take a picture? Jogita, Amishi. Jogita and Amishi are our volunteers who have been on the conversation with us here. And Ankita. Ankita? So a big thumbs up to all our partnerships now and collaborations. Thank you. Thank you very much.
Thank you.
Thank you very much for having
Thank
us.
you, everybody.
Thank you.
All the best.
Thank you.
Thanks, Vandana.